If you or a loved one are struggling with type 2 diabetes, you should visit the link in the description below. This clinically proven, drug-free program lowers blood sugar to a normal level and can completely reverse type 2 diabetes within just a few weeks. Here's today's video.
The question, what is the best treatment for type 2 diabetes mellitus? Answer by Michael Simpson. We cannot cure type 2 diabetes mellitus, T2DM. We can treat it fairly well with medications, if the patient is extremely careful with diet, exercise, and medications. T2DM can be temporarily reversed, in most cases, if the patient is willing to work extremely hard to get their weight to a healthy BMI, radically change their diet. Recent peer-reviewed research has suggested less than 50 grams of carbohydrates per day, and vastly increase their activity level. But if they quit any of that, the T2DM returns. As a last resort, bariatric surgery definitely can temporarily cure T2DM in most patients. Many patients do not require any medications for T2DM the day after surgery. And they can keep T2DM at bay as long as they follow the nutritional advice post-surgery. However, many bariatric surgery patients stop following their diet after a few months or a year, and the T2DM can return. There are a small subset of T2DM patients who are already at a healthy BMI, eat properly, and are quite physically fit. A lot of diabetes researchers want to classify them in another category of diabetes. So, at this point, there are no cures for the disease, probably won't ever be, because T2DM is a very complex disease, much more complicated in many ways than T1DM, which is a relatively simple condition caused by an autoimmune disease that destroys the insulin-producing cells of the pancreas. Answer by Jagulki. I think all would agree the absolute best treatment for type 2 diabetes should result in a cure for the condition, if indeed it can be cured at all. I speak from experience in this area since I have cured my diabetes using my own mix of natural remedies as treatment. No, I am not going to have you read my story to the bottom of the page and then try to sell you some patented secret to curing type 2 diabetes. But first, I was totally ignorant when I was first diagnosed, so I was taking metformin and lisinopril as ordered by my doctor, which helped me to control my blood sugar, but it was 4 years and no cure. Much of what I learned during my research is available for free on Diabetes Free by Nature, the all-natural way to cure diabetes. I started working on my knowledge of how the body works, which led me to a detox and some work to repair my gut and immune system. This step resulted in some strange outcomes, but I felt better after a couple of weeks. At the same time, I started replenishing myself on vitamins, especially those that are helpful for diabetics like vitamin B12, magnesium, chromium, and of course vitamin C. After detox, I began eating a much more plant-based diet, and some of the safer meats like fish and fowl, and sometimes wild game. Of course, I had already been watching my simple carb intake pretty closely, but started really watching them like a hawk, and cut out almost all simple carbs. I actually increased my intake of the good fats, unsaturated fats. Now that I understood they help your blood sugar to stabilize, I was already avoiding bad fats, but I did learn that trans fats are the absolute worst and you should never eat that kind of fat. You can say I was fortunate that I met my dietary expert who helped me learn about carbs, fats, and proteins, and how they can be considered the basics of life. Once my diet was started and going well, I started my exercise regimen. Mine consisted of running about 3 miles each 5 days out of every 7. My goal was to burn at least 500 calories daily. In about 2.5 months, my blood pressure dropped very low. My EMT got really nervous, so after I spoke to my doctor, I cut my lisinopril and metformin in half, and increased my salt intake slightly. In less than a week I had other problems that weren't normal, so I got an A1C done, and before the results came back I was laid up in bed for low blood pressure again. I called him the next day and he told me I could quit taking the drugs. My A1C showed 5.7 and I no longer needed help controlling my blood sugar. That was about 18 months ago, and I hadn't taken metformin or any other drug to help control my blood sugar. In my mind, the best treatment for type 2 diabetes includes diet and exercise, along with other elements like essential vitamins and possibly a detox to jumpstart your efforts. Some say that intermittent fasting is the answer, which I think may be an answer, but I encourage caution if you are new to fasting, but it seems like it could work too. Answer by Wayne Bodolick. Type 2 diabetes is not curable, but it is controllable. The disease is hereditary, meaning it's not only genetic, but also a recurring trait in family lines. About 70% of T2S, type 2 diabetics, have one or more T2 relatives. The underlying biochemical problem is insulin resistance at the cellular level. The cells of the body don't respond to the action of insulin. Insulin's job is to transfer glucose from the bloodstream into the cells. When that doesn't happen as fast as it should, the cells don't get the glucose they need, and too much glucose gets left behind in the bloodstream. To treat this, limiting carbohydrate consumption. Carbs are the primary, but not the only source of glucose in our diets, and getting regular exercise will bring BG, blood glucose, under control. Using a BG meter to see how different types and amounts of carbs affect your BG is the key to getting it under control. On exercise, regular physical activity, at least 4 or 5 days a week, at least 30 minutes, helps improve cellular sensitivity to insulin, active cells or insulin receptive cells. Exercise also burns off BG. But that's not the primary reason for maintaining a regular exercise routine. The improved cellular sensitivity to insulin is. Here's a useful site on managing type 2 diabetes, getting started. From that page, check out the 6 links on it. You'll learn a lot about T2 management. While there is no cure, T2 can be controlled, meaning, you can achieve normal, non-diabetic BG levels, and avoid all the nasty complications the disease is known for. But it's something you'll always have to work at. Good luck.